Good afternoon, everyone. Thank you for being here. On this Wednesday afternoon, snowy day, cold day, but it looks like we did not get the snow today that we were originally predicted, did not get as much. So that's good news. Today we're going to talk about COVID. We're going to talk a little bit about homeless folks and the shelter we're providing for them. And of course, we'll take your questions. We're late today because we just finished the Board of Estimate and Apportionment meeting about 20 minutes ago. That's a regular monthly meeting. Pretty uneventful today. Just, doing the regular business of the city. So, with regard to COVID, numbers continue to look better, much better. Currently, the city of St. Louis is reporting about 31 cases. This is the average, 7-day average, 31 new cases per day. There's about 10 people per 100,000, a little over 10. That's lowest in the region by a pretty good margin. In addition to that, for people that are hospitalized, as of, this is 2 days ago, there were 369 people in the hospital, COVID positive or suspected positive. That number is down significantly from just looking back to, say, January 16th, a month ago. It was 747, so it's about half of what it was a month ago. So that's good news. Also, looking at the number of people that are in ICU, 85 people are in ICU today, so they're still pretty sick, and of them, 56 people are on ventilators that are COVID positive. So hospitalization numbers are much better, new cases are much better. Patients admitted, the 7-day average for patients admitted to the hospital is an average of about 42 for the last 7 days. Looking back a month ago, the 7-day average was 104. So significantly better numbers. Everyone is very encouraged by that. Combination of mitigation, procedures, wearing your mask, social distancing, and of course, some impact of the vaccine. There's not enough vaccine, but there is some, and there's more coming every week. And so that is going to have some good impact here, we believe. Now, what everyone is, of course, still concerned about are the variants in the virus that is out there, some of which are said to be more contagious than the original virus. So we're worried about that, of course. The data suggests that the vaccine is still very helpful in preventing people from getting really sick. Doesn't necessarily prevent you from getting the virus, but prevents you from having the very severe symptoms that can hospitalize you or even die from. So lots of stuff to still worry about, but stick with the mask wearing, please. Stick with your social distancing, keeping your numbers small. So that we can keep these numbers down. So that's COVID. With regard to vaccines, tomorrow, Friday, and Saturday, well, let me back up and say 3 weeks ago, tomorrow, the city did 4,498 vaccinations over Thursday, Friday, and Saturday. If you were vaccinated then, you got a card. Your card tells you, come back on, if you were vaccinated on Thursday last time, come back on Thursday this time. Friday last time, Friday this time. Most of you who were vaccinated then got an email or a text message having you select an appointment time. It's actually a time slot, a 1-hour time slot. If you did not, I think there are still some emails that are going out on that, and most of the people are being contacted by email. But if you did not, if you're concerned about it, call the health department, which is 657-1499. And so that you can sign up for an appointment. When you come to the second vaccination on your day, bring your card. We'll also have a list. We know who did receive the vaccinations. But, you know, there'll be a lot of people there, and just to kind of try to move things along, bring your card. Ideally, get yourself an appointment. So that's good. We also expect next week beginning Sunday, Monday, Tuesday, we expect to be doing some vaccination in senior apartment complexes. We're working with the St. Louis Housing Authority. These are not nursing homes, but these are housing authority properties that are primarily older adults, people over 65. And so we'll be going there and doing some vaccinations there. What has proven to really be important in terms of having a very adverse outcome is age. And so in the city of St. Louis, we are focusing on vaccinating people 65 and above. And so that's the reason that we're going to have some visits to senior homes. Now, as soon as we get additional vaccine, which we expect to be within a week, expect that to be pretty soon, then we will do some additional vaccination events, primarily focused on 65 and above. So, I think, in case you don't, that we have vaccinated, given the opportunity for all of our police officers, firefighters, EMS, ambulance folks, corrections officers, sheriffs, all of those first responders who have been eligible for a while. Virtually all of them who want to be or are willing to be vaccinated have been vaccinated now. There's a few people that we're getting to for the first time who just weren't available, 3 weeks ago or something like that. So that's being done. Virtually all the healthcare workers have been done. And so now the focus, of course, is on people 65 and over and people with 18 to 64 who have serious underlying health conditions. So we're going to continue with that program. I know that there are other groups of people who need to be vaccinated also. Teachers need to be vaccinated, frontline workers, people who work in grocery. A lot of people need to be vaccinated. But right now, we have to focus on the eligible groups and the supply, which looks better. I talked again this morning to Dr. Randall Williams, who's the head of the state Health and Human Services Department. And so we will be getting additional vaccine. I believe that sometime soon, Walmarts, there's 2 Walmarts in the St. Louis area, one in North County, one in Shrewsbury, which will be doing vaccinations. You can get an appointment for those. I understand that the one in Shrewsbury is not taking appointments yet. There are other mass vaccination events around the area. There's one this Saturday at UMSL that you can get, unless it's full. I haven't checked in the last hour, but that you can register for an appointment. So, there are more opportunities coming our way now than there were a week ago, and certainly than there were 2 weeks ago. So, for those of you that are not in an eligible group yet, please be patient, and I know you're already out of patience. I understand that. But let the folks in the eligible classes go first, because as we tamp down this spread and as we're able to keep people out of the hospitals, that's good for everybody because there's less virus circulating in the community. So that's it for COVID and for vaccinations. As I mentioned a few minutes ago, everybody knows it's brutally cold, bitterly cold, and so the city of St. Louis every night, with the help of our volunteers, with the volunteers who are out there doing outreach to homeless services, every night this week we have had some beds still available in the range of 40 to 50, and they're scattered around. There are about 10 or 11 sites. And so these beds, there might be 5 in one site and 10 in another site. What we do every night after the warming bus comes downtown here at 13th and Chestnut, and it comes at 5:30, and we take folks to emergency shelter then. What we do then is we figure out how many beds are available in each location. I notify the police department, I notify the fire chief, who's fire and EMS, so that all the folks out working emergencies also know where beds are available. Very, very challenging situation. No one should be out in this weather, just literally no one. I think that the temperature's going to be up a tiny bit tomorrow.
50 by Wednesday.
Yeah, 50 by Wednesday of next week, but that's a week. So we're going to stick with this. And so just bear in mind that we're all very, very concerned about our unhoused population and making sure that everybody has a place to stay. By the way, all of those locations are also allowing people to stay during the day, so they're not putting people out during the day. So people have a warm place to be. So, questions?
Okay, questions today, Mayor. Starting with Judith, who's watching. Curious about any progress made to build up vaccine coverage in the city of St. Louis. She knows of many, many people who are driving 60 an hour or more away.
Right. So I think I just covered that really. As the city gets more vaccine, we will be doing more vaccination events. But I also am aware of people, I see it on social media, who say, oh, I drove here, I drove there. That's good. Take the vaccine where you can get it. But we do have to have sufficient vaccinations in the city of St. Louis or close by here in St. Louis County. I mean, this is a region, of course. We do have to have that, and we are continuing to vaccinate the most vulnerable people because not everyone can drive to wherever, an hour away or so. And so focusing on those people 65 and older.
So we have many people who are watching and submitting questions following up on their second doses coming up over the next 3 days.
Okay.
If they received it on Thursday, Friday, or Saturday 3 weeks ago, should they automatically assume that that is their day to come this week? And if they haven't received their email, when should they be getting it?
So yes, you should assume that if you got the vaccination Thursday 3 weeks ago, you're going to get it tomorrow. You should bring your card. You can call 657-1499. They will send you a link. If you didn't get an email, it means either that your email address, which I know you wrote on the form, maybe is illegible, maybe it wasn't input right, but you will have a spot on that same day. Bring your card. The folks there that are working the vaccination event they've got the list, they know you were there. So just come on that day, but ideally call and get yourself a time slot. If it's for tomorrow, time is running out. I do know that there are a few people, these emails went out in bulk, I guess is probably the word for it. And I know of people that we have their email address. I looked down the list and I saw some that had missing a period or missing, some of those are gonna bounce back. So come tomorrow, call 657-1499, get yourself a link, because then you'll be able to select 9 o'clock or 10 o'clock or 11 o'clock, and then I think it's 1, 2, 3, and 4, just so that you have a time slot. We're trying not to have everyone show up, at first thing in the morning and have a big line outside. We don't want that either. This is only for those people that are getting second shots. There are just a few city employees who will be getting some first shots tomorrow. They know who they are. And those were people that, firefighters, police officers who had to miss 3 weeks ago.
Joe has a question about teachers and what anybody at the city can do to try and get teachers vaccinated or move them to a higher priority.
So people all over the country, Joe, are working on that. Everybody believes that teachers do need to be vaccinated. But right now, the people over 65 there's still, frankly, millions of those folks who have not been vaccinated yet in the state. And so, you know, the teachers are very, very important. But the struggle is so are the folks that are checking you out at the grocery store. And so we're trying to get those people that are older vaccinated first. They're going to most likely have the worst outcome. So we all agree, it's just teachers are in what's called Phase 1B Tier 3. And right now we are in Phase 1B Tier 2, which is older people and people with underlying health conditions.
William's question, Mayor, has to do with the Walmarts and Health Marts. You mentioned Walmart. I don't know if you mentioned Health Mart, but when can city residents start making appointments at those locations?
So you can make an appointment now at some Walmarts. As of yesterday, the Shrewsbury Walmart did not have vaccine yet. That vaccine is coming direct from the federal government under the federal pharmacy program. And I know that some Walmarts in some areas do have vaccine, but they don't all. So, you know, you can go on Walmart's website and you can check to see if the one that's near you, and there are only two in they're both in St. Louis County, but in the St. Louis City County area. The Health Marts, I understand, do not have vaccine yet either. So, you know, this is a logistics issue. We are very hopeful, and, you know, I don't want to jinx it, so we're very hopeful that we are going to be able to have a partnership with CVS and Walgreens also, because there are a lot of those stores. There are about 30 of them in the city of St. Louis. It probably wouldn't all have it, but we're working diligently towards that, and that's what we have been talking with Dr. Williams about, because we need more opportunities, more places for people to get the vaccine.
A couple of COVID-related questions, Mayor. Andrew makes note that cases and hospitalizations are really falling. Is there a reason not to lift all of the public mitigation strategies?
There is, Andrew. I'm sure you've been following this, but even with the vaccination, they're saying you still need to wear masks. You still need to socially distance. And so I don't see those two things being lifted for a while. And I don't know what a while looks like, because this is a fast-changing environment. But for right now, you do need to continue to wear a mask and to continue to socially distance. So that, you know, if you have had the vaccine, for example, then you may not get extremely sick, but it's unclear, as I understand it from the Pandemic Task Force and other medical professionals, it's unclear whether or not you may still be contagious to other people that are around you. So I get it, we all want those things lifted, but these numbers have dropped precipitously in about the last 30 days. We need to sustain these numbers for a bit. And get more vaccine distributed.
Last question, almost 3:30. Sounds like Megan is watching and has an appointment for the weekend. Is the city recommending people to get there very early for their scheduled time slot?
No, Megan, if you're scheduled for 10 o'clock, don't get there more than 10 or 15 minutes early, because understand there were a whole group of people scheduled from 9 to 10. So, yeah, you don't need to get there early. If you're scheduled for 10 o'clock, I mean, obviously you'll get in line and we'll process those people that were 9 o'clock appointments first. I'm sure this will be, I'm sure it'll be difficult, but there's no need for you to get there super early.
That's it. It's 3:30.
It's 3:30. Thank you all for for being with us today. Stay warm. Looking forward to March for a little change in the weather. Thank you all. Appreciate it. Bye-bye.